We will be talking about exercise and Alzheimer's. My name is Edgar Ceniceros, and this is for class Neuro 325. So, learning objectives for today are being able to describe the symptoms, causes, and treatments of Alzheimer's, as well as describe how exercise impacts the rate of Alzheimer's, and lastly, describe how diet impacts Alzheimer's. So here we can see an Alzheimer's disease overview, or AD for short. Alzheimer's is a degenerative brain disorder of unknown origin. This causes progressive memory loss, motor deficits, and eventual death. It impacts the hippocampus, the entorhinal cortex, the neocortex, the nucleus, the basilis, the locus coeruleus, and the Raphe nuclei. It appears to be hereditary. Some genetic causes that we see are a mutation in the APOE gene. While there is no cure for Alzheimer's, there is promising treatment, such as vaccination against the AB peptide. Since we know that there is no cure for Alzheimer's, we can try to delay this. And the best way to do it is by exercise and intellectual stimulation to help delay. When speaking of exercise and reduced risk of Alzheimer's, we see that exercise is considered a possible lifestyle intervention to reduce the occurrence of dementia and AD. Studies have shown that physical activity can reduce the likelihood of dementia and AD, as well as lack of physical activity was identified as the highest attribute risk for AD. Duration of exercise or intensity seems to be essential for the benefit. In a study among 165 non-demented elderly people, those who were active had a higher level of health and larger hippocampus. They also had a better spatial memory, and this was seen by the MRI. As we know, there are different types of exercises that we can use as treatment for AD, and it comes with benefits. So a couple exercises here that I have are walking, cycling, gym work, aerobic, dancing, housework, gardening, and hiking. Some of these benefits include improved mood, better sleep, maintenance of motor skills, reduced rate of disease associated with mental decline, improved memory, improved behavior, and improved balance and posture. So when we talk about a healthy lifestyle, we think of physical activity, good hygiene, appropriate sleep, managing mental health, and healthy nutrition. So, narrowing down on the healthy nutrition, do you think that diet has an impact with AD? Well, let's explain diet. We think of nutrition as leafy greens, berries, fatty fish, nuts and seeds, whole grains, Greek yogurt, and some other vegetables. Now, I put a couple examples next to there, but a couple positives about these foods are, leafy greens are rich in vitamin A, C, and K, which support immune function. Berries are high in oxidants, which help reduce inflammation. Fatty fish, great source of omega-3, that helps with brain health. Nuts and seeds, rich in healthy fats and minerals, and also support heart health. Whole grains, high in fiber, promote digestive health. Greek yogurt, high in probiotics, calcium, B12, and protein. And these vegetables are rich in vitamins and phytochemicals. This can help reduce inflammation. So incorporating these foods into your diet provide a wide range of nutrients which support overall well-being and reduce the risk of chronic disease. So how are diet and Alzheimer's connected? Diet is connected with inflammation. So inflammation plays a crucial role in the pathogenesis and progression of AD. Obesity, as one of the AD factors, is doubtless related to low-grade chronic inflammation. Data shows that higher consumption of vegetables, fruits, nuts, legumes, and whole grains were significantly associated with higher mini mental state examination MMSE scores in 3,831 elderly participants. This pushes and presses demand in finding dietary factors which can modulate inflammation to help delay the progression of AD. So here I have a small chart, kind of shows midlife obesity. You can see has a good number of AD cases prevented, as you take actions towards that, as well as physical inactivity being the largest one. In conclusion, despite some conflicting evidence, several systematic reviews suggest a positive effect of exercise programs and healthy diet and/or lifestyles on AD patients, with improvements of cognitive abilities and global cognitive function.